When hospital workers steal drugs to feed their habit, it's called drug diversion. Nurses are no more likely to divert than doctors or pharmacists or paramedics, but the national addiction rate is 20%. There are 415,000 Canadian nurses. That means at any given time, some 83,000 nurses are struggling with addiction, all the while working in an environment with surprisingly easy access to drugs. Drug diversion has been described as a silent epidemic, and yet few Canadian hospitals will even acknowledge that it's a problem. Experts say drug diversion is vastly underreported. While the bodies that license nurses expect hospitals to report to them, there's little oversight to make sure they do. W5 found dozens of cases right across the country, and all were dealt with in very different ways. A nurse in Kingston, Ontario, was sentenced to 2 years in prison for diverting drugs from hospice patients, while a Quebec nurse was suspended for 15 months. Another nurse in British Columbia was fired and lost her provincial license. In several cases, W5 found nurses were reinstated. The hospital that caught Canadian nurse Julie never informed her nursing body about her addiction, so her treatment was voluntary.
I basically admitted to them that, yes, I was using narcotics from work, that I was going to go into a treatment program again, and I was just waiting for them to call the College of Nurses, basically, and they never did.
Even after a near-fatal relapse, Julie's hospital did not report her or mandate treatment. Rock bottom, Julie checks herself into a long-term rehab facility. She eventually went back to work at her hospital with conditions: no access to drugs, random testing, and a warning that if she relapsed again, she'd be fired. Julie has met several nurses whose hospitals did call the police, a sign that there's no standard way of handling addiction and theft cases in Canada. So why the difference? Well, there are no federal guidelines that dictate just how hospitals should handle drug diverters. Nothing that lays out who should be informed or what should happen to those who are caught. The result is a patchwork system that sees some nurses in rehab, others having their licenses stripped, and still others ending up in jail.